Welcome back to the Financial Breakaway Podcast, your clear path to retirement. I'm Ryan Hitchcock, your host, and I'm a financial planner with High Point Capital Group out of Milwaukee, Wisconsin. And it's my goal of this podcast to empower individuals like you to make a confident decision for a secure retirement. Hey, really quick before we get started, please remember to subscribe to this podcast wherever you listen to your podcasts, and feel free to check me out more at my website, rhitch.com. Now, everything said in this episode is for informational purposes only and should not be relied upon as a basis for any investment decisions, retirement planning decisions, or in this case, Medicare planning decisions alone. All statements regarding any companies made are strictly beliefs or points of view held by myself or any guest. So not a recommendation to buy, sell, or hold any securities. Not that we're going to get into that much. Now, if you've been following along in my past episodes, my recent past episodes, retirement health insurance, 7 must-know essentials, and then another one, retiring before 65, your health insurance game plan, we tackled a lot of like the fundamentals of managing healthcare costs in retirement. Now, we broke down some complexities of Medicare Parts A, B, C, and D, and we discussed some important enrollment periods. We highlighted how supplemental plans play a role in your overall strategy. And essentially, that episode just laid a strong foundation for what we are going to dive in today. Now, one thing I've noticed as a reminder from working with many clients is that while people initially think of retirement planning as like focusing on investments and focusing on finances, healthcare often gets overlooked, but it becomes the most important topic as we start to get near or enter into retirement. And so the reality is, as you approach retirement, your mindset starts to shift from just growing your wealth, growing your nest egg, to start to protect it. And rising healthcare costs, that's one of the biggest risks to your nest egg. And we have to plan for that. So planning for Medicare expenses, medical expenses, just in general, and then understanding your Medicare options, and then making the right coverage decision is absolutely essential for a successful retirement plan. So today, we're going to build on that foundation from my past episodes. We're going to give you 3 key Medicare changes coming in 2025. So open enrollment's on the horizon. We're going to talk about that. And we're going to understand these updates and how they will help you make an informed decision that's going to help protect your health and your financial future. So whether you're already on Medicare or just about to enroll, I'm sure these insights are going to be helpful for you. So today, I'm joined by Jerry-Ann Prom. She's a Medicare and health insurance specialist at our firm, High Point Capital Group. So she's a great addition to our team. And together, we're going to walk through these critical changes. We're going to cover everything from some premium adjustments to some new benefits in 2025. So with that being said, let's get into it. So Jerry-Ann, hello. Welcome. How are you?
Hi, Ryan. I'm great. Well, thanks for having me.
Yeah, thanks for joining. You're, I think, officially my first guest since I've kind of relaunched this podcast. But I'm excited to have you on. I think this is going to be a great episode to talk about some of these big changes that are coming with 2025. But first, why don't you just introduce us to yourself a little bit, give us a little bit about your background and what you do at High Point.
Sure. My name is Jerry-Ann Prom, and I specialize in Medicare and health insurance. I come at this understanding healthcare systems, long-term care, and the health challenges that many people face as they age. Working with High Point has been fantastic. Often the financial advisors introduce me to clients as they start thinking about maybe retiring, and understanding where they might be with respect to Medicare or not quite Medicare eligible yet. And I work with people to help them understand how Medicare works. Often it's great if we can do that well in advance so you're not surprised. I also do that urgent, oh crap, I lost my job. Kind of how do I get in Medicare, or how do I get marketplace insurance? How do I cover my family? Kinds of work. But I really enjoy the planning portion where we can work together to create the pathway for them to have the best options moving forward.
That's great. Thanks for sharing that. And just knowing you for how many years has it been there?
Two and a half.
Two and a half now. Our clients have loved it. Just being able to speak intelligently about all the changes that happen. That's what we're going to talk about today. But it's an ever-changing industry, and that's why we love having you, because it's hard to keep up with that amongst all the other retirement planning. So you're a great addition to complement all this planning that we do. So what do you think? Should we get into number one?
Let's do it.
Okay, so I have change number one coming in 2025 is to the prescription drug coverage plans, right? Part D. Tell me a little bit about that.
Sure. Part D can be a freestanding plan for those that have a Medicare supplement, or it's the prescription coverage within your Medicare Advantage plan. And it is a really exciting time as we look towards 2025 and the dramatic change that is happening. Anyone that's been on Medicare has likely heard of the Medicare donut hole. Anyone that has very expensive medications, or maybe they've navigated mom and dad and all of a sudden don't know why their medication is so expensive in May, June, July, and it's because they've hit that Medicare donut hole. Well, that donut hole is gone, so I am not going to take our time today to explain what the hell that is.
That's so good.
Because it really, was confusing, and it was very expensive. It left seniors very exposed to a lot of expenses. So moving forward, CMS, the Centers for Medicare and Medicaid, has simplified the Medicare prescription drug coverage, and has also made it more affordable for seniors, particularly those on very high-cost medications. So moving forward, the maximum out-of-pocket for any senior is $2,000. And many of the carriers have made that truly the exception, that most individuals will not exceed even $1,500. So that's a real positive change for seniors moving forward.
Before this 2,000, it could be up into the many thousands, right? With that donut hole.
It could. With the donut hole, there were confusing copays you had. You paid a certain percent of cost. And then in 2024, it was the first year that when you did hit that catastrophic phase, that you had zero copays. That continues. Once you hit the $2,000, you have zero copays moving forward.
Okay. Explain what the catastrophic kind of means in lay terms a little bit.
Catastrophic means that you've hit the maximum out of pocket.
Okay, so you had some medical situation that,
or you're just on a
lot of high cost drug,
either high cost drugs or enough medications.
I gotcha. Yeah, because this is Part D. Yes,
that you get there, and so I do find people that are often on one or two brand name drugs, maybe, or have two or three chronic conditions that they're medicated for, are likely to have those level of expenses. And so this reduces their maximum out-of-pocket exposure.
Is there anything else inside of that plan with price on Part D?
And what's happened, though, is this has been a very mindful and intentional activity on the part of CMS, driven by the Inflation Reduction Act. It's been a 3-year process to get to this point. And so the carriers, the people that actually you buy the insurance, the insurance carriers, they've had to figure out how to deliver on this promise. And so they have done different things, like the drug formulary, the list of prescriptions that your plan's covered. That has been, all of the carriers have taken a close look at and determined their formulary. They have looked at how they tier their medications. Tier 1s are your very inexpensive generics, and it goes up from there. And they've looked at how they administer copays or assign copays for the various tiers. They've looked at how they apply a deductible. So, for example, they're allowed to have up to a $590 deductible, but plans have a level of control in terms of if they apply that across all tiers, if they apply it only on the higher tiers, or if they come up with a different number. And so that's what's creating the cascade of changes to the Part D plans or the Part D within your Medicare Advantage plan, is that there may be differences in your in the medications that are covered. So if you are a policyholder, you want to make sure your medications are covered. There may be differences in the pharmacies they contract with. You want to make sure your preferred pharmacy is in there. There may be differences in how they tier medications. So, and usually this works to your advantage. You know, year over year, if a drug has been tier 3, there's a chance it'll move to tier 2 if it is more frequently used and things like that. So it becomes real important to review your own coverage, and I advise doing that with a licensed agent that can look at your specific medications and your plan and the other plans available to you to determine which plan is going to be most cost effective for you.
So what about insulin? I know, talking with clients all the time, that comes up, in every conversation, obviously, if they have a need for that. What are the costs there moving forward?
As part of the Inflation Reduction Act, starting in 2023, there have been many instances or legislative activities that require insulin to be capped at $35. Now, what gets confusing for people, and I'm not going to sit here because I would mispronounce all the different names of insulin.
Yeah.
There are many forms of insulin, many brands of insulin. The carriers are required to cover usually 2, and they usually do. And so sometimes it's a matter of making sure your doctor, and the plan are all working together to make sure you are prescribed the insulin that's in coverage for you.
Well, that's good. Well, so if I were to kind of sum this up, so in our number one, there's changes to prescription drug coverage, and the main thing to get from this is that the donut hole is going away, and the max out of pocket is $2,000. There's some the continuation of the $35 on insulin, and then there's some changes going on with the formula changes or formulary changes. Is that what you call it? For the classification of some drugs. Does that sum it up pretty well?
Yes, and I think more than ever, people who have been in Medicare for a while and maybe they're coasting along, this is the year they have to look at their plan.
Okay.
Just in case that one med is no longer in formulary, or if their pharmacy is no longer covered.
There. Okay. That's great. All right. Well, let's go to number 2. What do you want to go into number 2? I have adjustments to Medicare premiums and deductibles. Does that make sense to you? Do you want to take that one?
Oh, it does. Okay. Sure. So if you've been in Medicare for a while, you know that you pay that Part B premium.
Part B, yep.
And the Part B premium moves around every year. It has actually in the past gone down once or twice. It usually goes up every year. And so in 2025, the base rate for Part B is going up to $185. That's up from $174. Not a huge increase, but it's an increase.
And that comes right off of somebody's Social Security if they're on Social Security.
If they're taking Social Security, it comes right off of that. Yep. If you are paying for it, you get a bill per quarter. For that. Yeah. And so that can be a little shocking sometimes to see the 3 quarters together.
Correct, if they're not ready for it, yep.
Yes, and this is the base rate. And this is where, again, working with financial advisors as people are looking at their income, there are additional fees that can be assigned if your income is higher. And so planning early for what your income is going to look like when you're Medicare eligible becomes important. It can go, the next rung up is at $259, and it goes as high as $628. So
Yeah,
it'd be pretty steep.
Exactly, and that's, I think, the IRMA brackets. So that's what these are called, these IRMA brackets, which are income brackets that dictate, if you're making too much money or more money, I should say, not too much, but if you're making more money in retirement, that's where some of these surcharges come in. And I talked about that in some of the past episodes, but I think it's a great example of the intersection, right, of retirement planning and healthcare planning. Because of these things, if you don't plan for them, they can really kind of come up from behind it and bite you. To have that's like a 40% increase from just the next bracket in the IRMA. So that can be very shocking. So I think I like that one. Any other insights into these adjustments or anything?
Some of the other costs that, and if I just back up for a minute, everyone should have received an annual notice of change document from their current carrier.
Okay.
These are really boring documents that you probably use to put your coffee cup on and things like that. This is the year you got to read it. And it does define all the changes of your current plan. And so while the Part B premium increase is the most black and white, within your plan, what I'm observing is that there are little premium tweaks to some of the Medicare Advantage plans. There are premium changes, some significant ones to the Part D plan, some of them going way down, some of them going up. And then if you look at the fine detail of your Medicare Advantage plan, if that's what you're in, there are changes from the maximum out of pocket for your health care to the co-pays to different, some are introducing some medical deductibles. So there's a lot of changes within those plans. And so it's really important to understand if your plan is still going to be most cost effective for you.
Okay. So that seems like we're kind of getting into number 3. Seems like there's some changes in the Medicare Advantage plans. And so before I let you get into the number 3, put you on the spot, what is at the base the difference between a Medicare Advantage plan and a Medicare supplement plan in your view?
Very simply, pay up front or pay as you go.
Okay.
It is a real
good way to describe
simple way of that. So a Medicare supplement, you pay a premium, and it covers the costs left on the table after Medicare pays.
Yeah, so like a premium. So like you're paying a higher premium, you mean? Yep.
Right. And, these plans are pretty straightforward. They're highly regulated. Every plan pays exactly the same, as long as you have the same plan with the carrier. There are different variations on that theme. But, and then you partner that with a Part D. Your other option, and a very popular option, is a Medicare Advantage plan, also called a Part C plan. And with Medicare Advantage, you pay as you go. And so you can usually slide into a Medicare Advantage with a very low premium, in many cases no premium. I'm supposed to correctly state that as a 0 premium.
Okay.
And you pay co-pays as you go. And each plan has a maximum out of pocket, which is one of the critical factors that I look at when working at people. It's like, what's your main exposure if the wheels fall off and you become a high utilizer? And so that maximum out of pocket is really your safety net in many respects.
And can you change from one plan to the other?
Welcome to Medicare AEP.
Okay. Annual enrollment periods. There
you go. From October 15th through December 7th, you are encouraged to review your plan and make an informed choice about staying put in your current plan or moving to a plan that better meets your needs. And you can change your Medicare Part D plan during this time frame, and you can change a Medicare Advantage plan during this time frame.
So we're in the middle of it.
We're in the midst
Or
of
the
it.
thick of it right now. Okay.
Yes.
Good luck to you.
Yes.
Okay, so kind of getting back to the changes, number 3, the Medicare Advantage Plan updates. Maybe give us some of those highlights again.
It's usually most carriers will have their next year's contracts done with the various providers. And I am seeing in some areas, I'm licensed in several states, and so it really varies based on where you live, that there is provider disruption and plan disruption. So some of the carriers are limiting the number of plans they have.
Okay.
And so you may be one of those people that's in a plan that, it's not going to be here next year.
Oh, interesting.
And so you have to navigate to a new plan. Or you may find out your favorite hospital is no longer in network. And so understanding that kind of disruption is also real important to make sure you're sitting with the plan you want to be with.
That's great to know. Okay, so we've gone through 3 so far. So let me just throw a little extra credit one at you as well.
Okay.
So I took some notes. I think that the demographic, the retiring demographic, is getting pretty tech savvy these days. Are there any changes going on with telehealth or remote care for Medicare?
Yes. Yeah, well, in just in healthcare in general,
Sure.
as I look at both the Medicare carriers,
Okay.
as well as when I work on other health insurance for people, there are several plans that do include a service. Teladoc is a brand name.
Yep.
But like services like
Virtual
that
health
as a first point of coverage. People find that very useful. And we hear about that on the radio from some of the local health systems as well, that
I think
first
that's awesome.
virtual coverage is very available.
Kind of available through most plans.
And that usually reduces, many carriers will incentivize that utilization by having a zero copay if you do your urgent care visit, or having that copay be lower than an in-person. Always with a caveat, you do what you need to do for you.
Well, and that's a good segue. I think even if we just back this up to, looking, you're getting close to, or someone's getting close to retiring and they're looking at their health insurance options, what are some of the main things you have them look at? Like, obviously their health and prescriptions, but is it like, are they looking at their lifestyle activities, or do they travel? What are some main things that they should be, checking the box on that will help them decide?
You hit a lot of that.
It's a good guess.
Yeah, often it's wonderful when I can meet early with people when they're just, again, thinking, trying to understand, trying to learn how it works. And we talk about things, is it just them in the household that's moving towards Medicare? Is there a spouse working? Where does employer coverage fit in? When we look at Medicare, I do listen for things if people want to disclose that they're in line for various procedures or have certain chronic conditions. There may be a plan that's better suited to them. I often hear, it's like, what do people look forward to in retirement? It's the travel.
Exactly.
And so really understanding what plans are going to work well and support that lifestyle. If they don't know where they're going to live, I talk to people all the time that they've got kids all over the country, and they may pick up and move to be closer to one of their kids. And so how does that work? How, we talk about how that works.
Because supplements, which not many people might not know, is that they're
They move
either of
with
them. They do, but okay, I thought they were more the ones that you originally get. They're more by your zip code or something. Are they priced by your zip code, or explain?
Oh yeah, it's everything is down to the zip code and in terms of pricing and what plans are licensed. But one of the differences between a supplement and a Medicare Advantage plan is that supplement moves with you.
Okay.
Meaning all we do is correct the address.
I see.
There may be a little premium wiggle because of that.
But the coverages are similar.
That being said, I don't want anyone to be alarmed. When you move, even if you move within state, but out of a service area of a Medicare Advantage plan, you are given an open enrollment period. It's called a special election.
That's one of the special elections. Okay.
And it's really important to know that.
That's
and that
great fact to know.
Yeah.
Yeah. Well, good. Anything else you want to share about that we might have missed for changes coming in 2025? Anything you think is important?
Well, I think what's really important is for people to understand how the changes impact them. I've met with a lot of people already this open enrollment period, and for some of them, it doesn't feel like much of any change. But for others, it's very dramatic, and we really need to look at new plans. And so I think getting very specific on what's in it for them, how is it affecting them, is real important. And I do recommend working with a licensed broker that can help you navigate that.
Oh, that's great. I think it's good. And I think, just to continue on that, I mean, from what I'm hearing from you and what we, see coming down the line, this is a big year coming for Medicare. Mm-hmm. So make sure that you're planning. And like you said, getting personalized advice is very important. That's why we, have this good dynamic set up at our office. We think we're pretty unique in that. So how can we, or anyone listening find you specifically, Jerry-Ann?
Well, you can email me directly and you'll get a scheduling link in return. Okay. My email is gprom, that's PROM, at hpcg.com.
Perfect. And also feel free to get in touch with me and I can connect you with Jerry-Ann. But thank you very much for being on here today. I do appreciate that. It's very informative. And until next time, we'll have a good day and be well. High Point Capital Group is located at 1200 North Mayfair Road, Suite 300, Milwaukee, Wisconsin 53226. Phone number 414-253-4600. Securities and investment advisory services offered through Osaic Wealth, Inc., member FINRA, SIPC. Osaic Wealth is separately owned in other entities and/or marketing names, products, or services referenced here are independent of Osaic Wealth. Views expressed here should not be construed directly or indirectly as an offer to buy or sell any securities or services mentioned here. Investing is subject to risks, including loss of principal. Past performance is not a guarantee of future results. Indexes are unmanaged and investors are not able to invest directly into any index. Sector investing may involve a greater degree of risk than investments with broader diversification. However, there is no guarantee that a diversified portfolio alone will outperform a non-diversified portfolio in any given market environment. No investment strategy, such as asset allocation, can guarantee a profit or protect against loss in periods of declining values. Please note that individual situations can vary. Therefore, information should only be relied upon and coordinated with individual professional advice. Ryan Hitchcock believes the information presented here is accurate and was obtained from sources that are believed to be reliable. However, Ryan does not guarantee the accuracy or completeness of any information, and such information may be subject to change without notice from Ryan. Statements expressed by guests on this podcast are the views of those guests only and not of Ryan Hitchcock. Statements contained in this podcast may be statements of future expectations and other forward-looking statements that are based on Ryan Hitchcock's or guests' current views and assumptions and involve known and or unknown risks and uncertainties that could cause actual results, performance, or events to differ materially from those expressed or implied in such statements.